I'm Dr. Jyotinder Khanna. I'm a laparoscopic surgeon working at Apollo Spectra in Kailash Colony and in Kailash Hospital in Noida, Sector 27. Today I'm going to speak to you about a very common problem, and now it has become one of the most common surgeries being performed anywhere in the world. It is about gallstones. Gallstones are stones which are found in gallbladder. Gallbladder is commonly known as pith ki theli in Hindi, and nowadays many people get a routine ultrasound done. At times they get it done themselves and they discover that they have gallstones or stones in the gallbladder. uh, the treatment for gallstones which is acceptable and complete is to do a surgery to remove the gallbladder. The gallbladder needs to be removed so that the stones do not form again. The reason for this is that the reason why stones form is that the gallbladder is diseased. It cannot function properly and it results in formation of stones. It is something which is similar to stones being formed in the kidney, but because kidney is very important for life, so kidney is not removed, but only stones are removed. Whereas in gallbladder stones, because gallbladder is not important for life and there is no lifelong changes that need to be taken, gallbladder is removed so that stones do not form again. Uh, the treatment is surgical, but when to do it is a very often this is asked from us and it is asked from many physicians whom most of the doctors go to. Very often it is said to the patients that because the stones are not troubling you, you may avoid doing surgery. Of course, that is a very good option, but as surgeon, we have seen very serious complications occurring as a result of indefinite waiting. This may result in acute infection of the gallbladder, which may be very troublesome. It may occur at a time which is inconvenient to you. Very often, these kind of patients visit emergency room in the middle of night. The entire family is disturbed. So this is the simplest of complications which may happen. There can be far more serious life-threatening complications which may occur as a result of slipped gallbladder stones. Very often we see stone which has slipped into the common bile duct, which is known as pith ki nali, and that can result in jaundice, which is pilia, and infection or complications within the liver system, bile system. The stone may slip further down and result in blockage of pancreatic duct and swelling or inflammation of the pancreas, which is known as pancreatitis. This is also a very serious condition and may at times be life threatening. Occasionally, we have seen patients who had known they had gallstones, but they chose to wait and they straight away landed in severe condition of acute pancreatitis, and a few patients were lost because they did not get their stones relieved on time. Therefore, based on these kind of experiences, we tell all the patients to plan their surgeries when they start developing early symptoms, or if they get time or like they travel a lot, uh, they are they are anticipating some other serious issues relating to their job or families. They should plan the surgery so that it does not trouble them when they need to be free of any disease. Stones are troublesome, and generally they can trouble you when you least expect them to cause you any trouble. A simple surgery which is done in asymptomatic or patients with mild symptoms is very simple, straightforward. It can get over as early as 15 to 20 minutes. That is the surgical time. And in a difficult case, we may spend up to 1.5 to 2 hours and may still need to convert a laparoscopic procedure, which is a keyhole surgery, to an open procedure, which is more debilitating and requires more time to recover from surgery. Of course, if the patient is sick and there is a lot of inflammation around and we need to operate, the chances of injuries to structures around the gallbladder also increases. So injury may occur to liver, to common bile duct, which is pith canali, to the bowel which is surrounding the gallbladder, and these are more likely if the disease is bad, the patient is having severe infection, inflammation, rather than somebody who is having a simple mild uh, gallstones disease. So, based on my experience, I always find it prudent that it is better to do surgery in a planned manner, especially those patients who have cardiac risk, other medical conditions like diabetes, heart disease, are on blood thinners. They need to plan their surgery well so that all other disease conditions are controlled and the outcome of surgeries are good for them, and their hospitalization or hospital stay is minimized. Generally, post surgery, if the surgery goes well, more than 99% of the patient can go home by the same day evening or maximum by next day morning, and they need to rest at home for next few days, and by the end of week most of them are able to join their workplace as well. Whereas in a complicated difficult case, the hospitalization itself may extend up to 2 weeks, which can be financially and emotionally a very crippling condition to the patient and their family. So the request is to, if you know you have gallstones and if you have mild symptoms, you should consult a surgeon and make sure that you are guided according to what is the best for you, and take a quick decision about surgery, because there is no other treatment which is effective either in naturopathy, homeopathy, or allopathy. The treatment is only surgery. So might as well do it when it can give you the best results. Thank you.